Hi, everyone. This is Gina Villiotti, Madison, the Executive Director of NASH Knowledge. And I have the pleasure and the honor today to be speaking with Nada Hassanein. She is a environmental and health inequities reporter for the USA Today. And Nada recently wrote an article that I'm going to put up on the screen here. And that article is titled, "A Quiet Liver Disease is on the Rise in Kids and Hispanic People, What You Need to Know." So for those of you who follow us here at NASH Knowledge, you know that this is a topic that is just near and dear to our heart. Our number one priority at NASH Knowledge for 2023 is raising more awareness and providing more education and knowledge around non-alcoholic fatty liver disease and NASH, specifically within the Hispanic community, and then also with kids. So we were super excited to read her article, which we felt was really well written, and even more excited to be able to speak with her today. So Nada, thank you so much for coming on to chat with me today.
Yeah, absolutely. It's a pleasure.
Yes. I want to thank you for writing this. There continues to be a gap in the general public around non-alcoholic fatty liver disease and around NASH. And as I was reading your article, you just really hit all of the points so clearly. And it was just so, you could tell it was just thoroughly researched and well written. So maybe I'll just start off by asking you, what kind of spurred the idea to write this article? Why did you write about fatty liver disease?
Yeah. Thanks, Gina. So I had been, hearing about, a couple of clinical trials focused on, this disease. And I wanted to kind of delve into the disease itself and help, readers understand and the public understand, what it is. I don't think it gets a lot of awareness, and wanted to kind of show, what the statistics are looking like, who is most at risk, and just kind of shed light on, this disease that doesn't, get a lot of awareness.
Thank you. You did a great job doing that. Before you wrote the article, did you know much about this disease?
So I had heard of it, but there were, different statistics that I, wasn't aware of. I didn't know that it was on the rise in kids, for example. And so I wanted to make sure to highlight that and the fact that it was disproportionately affecting Hispanic and Latino communities. And so, I tried to think also from a reader perspective, what as a reader, who maybe has some of these risk factors, like what would I want to know, and tried to kind of include that, in the story, while also, telling a patient's story about, what it was like to get diagnosed, and what she went through, how she's managing it, just to help, readers relate and kind of see how it affects a person's life. And
thank you. Like I said, I thought you did a fabulous job. Our nonprofit was founded by my dad, who was a patient himself. So we have a heart, for patients. And as I was reading your article and that patient story, it was just so relatable. And we actually, even my mom runs a support group for our organization. And just some of the things that I read, she talked about, she was shocked. She was devastated. Those words that you use, those words that she used that you put in that article are things that we hear all the time from patients, and just getting that patient story out there, like you said, making it more relatable. I'm hopeful that will help people really understand, this issue beyond just the numbers, because the numbers are startling. The numbers truly are startling, and they're continuing to rise, but there's people behind those numbers. And this lack of awareness is kind of a stumbling block in getting patients the care they need, or helping them not feel, so alone. What was there maybe one or two things that really surprised you the most as you were talking, to the patient that you interviewed?
Yeah, she had described, how exhausted and drained she felt. And, how just like a really quick trip to the grocery store would just exhaust her. And, she had to quit her job. And so I was shocked by that, and how, how much this, disease, before she even knew that she had it, how it was playing out in her life.
Yeah. Yeah, that's something, and that's another thing. I know you covered this in the article as well, that most of the symptoms are silent. And I know with my dad in particular, he was just tired all the time. But he was also getting older. He wasn't as young as the patient that you interviewed, and he was just getting older. So he attributed it to young age or to old age. I'm sorry. And I think that's the thing. A lot of people, the symptoms that do show up a lot of times aren't things that are overly alarming, where you may relate it directly to liver disease, because a lot of the symptoms are silent.
Exactly. And, that's why I wanted to make sure I included that, researchers and experts, have been saying, it is a quiet disease. And so that's why when folks have the risk factors that, maybe screening would be a good idea to just be proactive, and kind of get ahead of this silent disease.
Yes. Yeah, no, for sure. And that's a good transition, actually, because screening's so important. And for a long time, liver biopsy was kind of like the golden standard. And now there's so many more non-invasive tests out there, which is great. But we have still such a long runway ahead of us, in getting access to that. And I know you cover a lot about health inequities, and you even spoke in your article about with the Hispanic population in particular. So this population does have a higher prevalence of the disease. Yeah. And at the same time, they don't have as much access to care. And so that really creates a gap there. And that's something that we're, trying to address within our nonprofit, just getting that awareness out there. But awareness only takes you so far. Then you need to take action. And that's hard sometimes when there is that, gap in health insurance or just access to care. Can you maybe just talk a little bit about what you discovered as you were writing your article, just around that kind of angle, if you will?
Yeah. Various structural barriers, present really, really, big hurdles to getting, the healthcare that people need for various chronic conditions. And this is included, once they find out that they have it. I, will say that I think that this is just kind of, it was a great opportunity to kind of remind readers of different populations that disproportionately lack access to healthcare and insurance. And it was also, interesting to note, how researchers are still trying to look into why Hispanic people specifically seem to be at higher risk or disproportionately suffer from this. And so, we know that race, isn't a biological construct, but they are looking at genetic predispositions, that could be, prevalent in Hispanic people and Hispanic patients versus other patients, and just kind of looking at whether or not, targeting, treatments to that knowledge might be helpful. But that's all still being researched, and I wanted readers to know that there is research out there, and people are working on, trying to understand the disease better and help patients. I spoke with a physician in Texas who actually, does outreach, in predominantly Hispanic neighborhoods, sharing, flyers and like field days, just, outreach days that are dedicated to educating about NASH. So there are various events like that going on that experts are holding. And, it's good to keep your eyes peeled for those too.
Yeah, no, I think that's great. I think, we always talk within our organization with other liver nonprofits that we work with in the industry, that we are stronger together. And the more that patient advocacy groups can work with the providers and just kind of work together to get that information out there. The more the information is out there, the more the patients can then understand and just be aware. There's, a lot of clinical trials out there. And I know for some clinical trials, there's difficulty just recruiting patients because there's a lack of awareness. So people don't know about it. And then also, as it does relate to, kind of gaps in care, I did want to just call out, and I'm going to screen share again here at kNOWledge. We actually work with, we have on our board a gentleman, David Garcia, and he works for the University of Arizona. And he has an organization, Nosotros Comprometido, a su salud, which in English means we are committed to your health. And they get out there in the community and they're really focused on reducing health disparities that are faced by Mexican origin communities and other Hispanics. And I think it's great because they're really working closely with under-resourced and underserved communities, and they're doing FibroScan testing. So they're doing just kind of that diagnostic testing within the Hispanic communities. They go to what they call swap meets here in Pittsburgh. We call those flea markets, but just like the doctor that you just spoke about. So I think the more that we get folks out there in the community, just sharing the information, and it's so great. I love hearing about others who are out there, because that's really the heart and soul of what we do at NASH Knowledge. We really are a grassroots organization founded by a patient. Goals like this. It just, kind of I feel sometimes like it's just a constant uphill battle. And then I see an article like yours and I'm just like, wow, she really gets it. And it's so great to just get that information out there on such a broader level. So I'm just so grateful for your article because this really is a silent public health crisis, and it is tied along with obesity and diabetes and just continuing to rise. Mm-hmm. What is like one thing you would share with your colleagues or just the general public that you learned about this disease, maybe getting more stories out there about this or how we can raise more awareness?
Yeah, between a quarter and a third of the population, has fatty liver disease. And so I think that really shocked me just how common it could be.
A lot of people associate liver disease with alcohol consumption.
Yes.
And there's a huge stigma there. So that's why it was so great that you talked about the kids as well, because we try to talk about the children, not just because this is our future generation and we need to be concerned about the food they're eating and what they're drinking, but it also helps break that stigma as well.
Yeah. And according to estimates, rates are also rising in adults in their 20s. And like you mentioned, children. It's also the leading cause for liver transplants for women, according to research. So, it is affecting people's lives. It is, affecting different age groups rapidly.
Mm-hmm. Yes, no, it definitely is. And it's scary. And it's scary that there's such a lack of awareness, but it's growing at such a fast pace. I really think we're going to be hearing about it more and more and more. Mm-hmm. So again, appreciate your article. Before we wrap up, is there anything maybe you didn't share in your article or just now that maybe you think is important to just kind of close on or share with folks?
So non-alcoholic fatty liver disease is the most common form of liver disease in children. Estimates actually show between 5 and 10% of American children have the disease. And so it is rising, but it also affects, a significant proportion of children, and Hispanic children, are also making up a disproportionate number of those.
Yes. No, they are. And actually, I'm glad you just brought that up because I have one more thing now too. So I'm going to share my screen just one more time. One of the resources that we have at NASH Knowledge that we, so I didn't share this. We actually created a website that is Hígado Grasso. So we did not just take our website and do the Google translation and you can put it into Spanish. We've actually created a Spanish language website to just help really more closely resonate with the Hispanic community. And we're hoping to bring on some interns who speak Spanish as well, just to really make sure that we really can not just get the information out there, but that it's really relevant. And then the other thing is you talked about Hispanic children also. The other thing that we have is we have some animated children's videos that we created as well that are on our YouTube channel. And we have them in both English and in Spanish that just talk about the liver, what it does and why it's so important to eat healthy. And why it's so important to understand about the liver and liver function. So I just wanted to share that real quickly. Since you brought that up, I forgot to share that. So I appreciate you bringing that up because it is, it's scary when you really pause and think about it. I'm actually a mother myself and my son is like pre-diabetic.
Mm.
And we were just at the pediatrician recently, and I was talking with the pediatrician about this and asking, can we get blood work for him? Just, and I know about this. I'm very closely connected. I think the more that we get out there, not just for the general public, but for general practitioners to be doing this testing as well. I know that's something you've covered in your article also.
Yeah. The physician I mentioned in Texas, she actually provides training for general practitioners and pediatricians in her area, just so that doctors are kind of more aware of things to test for.
That's great. Oh, that's excellent.
And I'll check out those animations. Thank you for telling me.
Yeah, of course. Well, thank you again so much for writing the article. Thanks for coming on. I'm going to link to the article as we share our little video interview here as well, so that more folks can read it, because it truly, you just broke it down so nicely, and that adding the patient story in there, and then the experts. It just really hit home for me. So I'm just so grateful for that. So thank you.
Thank you, Gina. And thank you for sharing your story and the work that you guys do. It was a pleasure chatting with you.
Thanks. You too.